Nutrition part, we make sure that they take enough calcium because osteoporosis is one of the cause for weakening of the muscle, and osteopenia, the content of the bone gets reduced. So we make sure that they take calcium supplement every day, and vitamin D3 also is given every day, and some of them may require even omega-3 fatty acid, which helps in increasing the bone density and strengthen the bone. Physiotherapy plays an important role in preventing fall. So to strengthening the muscle and the gait, physiotherapy is very much important. We have a physiotherapy department in all the facilities and trained physiotherapists in all the facilities. So this physiotherapy definitely improve the gait imbalance and the stiffening of the muscle, relaxing of the muscle. The joints will become very stiff, and all this makes them fall, and we don't want the progression of the disease to go on and get complicated. So to prevent this, physiotherapy is being given to all the clients, whether they require or not require. It's like doing an exercise every day. Now to talk about the medications, other medications like most of them will be on antidepressive drugs or antipsychotic drugs and anti-anxiolytic drugs. So these drugs will definitely have a drug interaction on all the side effect of the drugs or will produce some amount of sedation. So those who are all on these drugs, we make sure that we tell the caretaker or nurses to take care of them, so that they don't fall when they get up in the morning. They have some amount of sedation, and this giddiness will always push them and they will fall. So the revision of medication is very, very important, and we do revise the medications very frequently and take care of the clients by telling them these medicines will produce some amount of sedations, and we make sure that there is a caretaker taking care of them whenever they get up and move to the restroom, or they want anything to take from or use any of the things which for example the reach of the glasses, newspapers, water. We make sure that the caretaker is there and help them. At Athulya, how do we help them from preventing fall is we have a regular checking of vitals. Early morning they check for sugar in diabetic patients, and they check their blood pressure and taking the temperature, and so these things will give us a clue whether they are going in for a hypertension or hyperglycemia, or if they have temperature, when they have fever or a predominal syndromes which they look very clinically sick. All these things put them into fall. So to prevent this, a regular monitoring of vitals is being checked in the early morning and in the afternoon, in the evening. And for the sick people, we always do it very frequently. 2 hours monitoring of the vitals is also being done. So all these measures is taken care to prevent fall. Not only all the infrastructures we have created in Athulya to prevent fall, and we also do clinically most of the things which they put them into fall is being prevented by checking vitals every day. Apart from all these infrastructures, we also talk about the clothing which they wear, whether it is an inskirt or the Bermudas or the sari, for men is a veshti or anything. All has to be 2 inch above the ankle, so that they will not slip or stamp on their clothing and fall. So we make sure that their clothing is always above the ankle level.